Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, what are the treatment of raised intracranial pressure? So, whenever there is raised intracranial pressure, how do you treat the patient? So, the aim of treatment of raised intracranial pressure is to maintain the intracranial pressure to less than 20 millimeters of Hg, and you will also maintain the cerebral perfusion pressure to more than 70 millimeters of Hg. Okay, then how are you going to do this? First, if there is any CSF, you can drain the higher CSF, like in hydrocephalus. You can drain the CSF via doing a ventriculostomy. Then you will have to elevate the head end of the bed. If you elevate the head end of the bed, due to gravity, there can be some blood which is diffused, some CSF which is diffusing into the blood, which can reach the lower limbs. And you can give diuretics to the patient, which will flush out the extra blood volume, so thus decreasing the blood volume, decreasing intracranial pressure. So diuretics like mannitol are used. Remember, furosemide, which is used in heart failure and other conditions, is not used in raised intracranial pressure. You can also use steroids. In the steroids, actually dexamethasone is used first for raised intracranial pressure due to vasogenic edema. If the raised intracranial pressure is due to vasogenic edema from tumor or abscess, then we use steroids. Then we can also do sedation. In the sedation we can use morphine or propofol, or diazepam can be used for sedation in raised intracranial pressure. Then we can also do hyperventilation is stimulated induced. We should induce hyperventilation to the patient so that the partial pressure of carbon dioxide should be between 30 to 35 millimeters of Hg. Then we can give pressor therapy to the patient. In the pressor therapy, we can give drugs like phenylephrine or dopamine or norepinephrine can be given. So this pressor therapy will actually help us to maintain the adequate mean arterial pressure. So it will help us to maintain the mean arterial pressure so that the cerebral perfusion pressure should be more than 70 millimeters of Hg. Then you can also consider other therapies also, like for example we have second tier therapies are available for refractory um, elevated intracranial pressure. Like we have drained CSF, we have elevated the head, and we have given diuretics, steroids. Sedation is also done with hyperventilation and pressor therapy, but still the intracranial pressure is not decreased. In such cases, you can give the patient high dose barbiturate therapy. In high dose barbiturate therapy, here high dose barbiturate will induce coma in the patient, so this is called as pentobarb coma. Okay, so this can be given to the patient. And if it is not even if this is not sufficient, then you can do hemicraniectomy also, so that if you remove a part of the cranium, so obviously because of the pressure on the brain will decrease, and this will have a better effect.
thank you and thank you for watching.